Thanks for joining us. I'm Dr. Bill Polonsky, a clinical psychologist, CDE, and also head of the Behavioral Diabetes Institute, where my colleagues and I have helped thousands of people with diabetes over the years. In addition, I'm an associate clinical professor in psychiatry at the University of California in San Diego. Today we're going to focus on several of the key problematic, harmful beliefs about diabetes that many of our patients struggle with. We'll discuss some tools and techniques that can help you to understand, identify, and address those beliefs. We'll then look at a few case studies that demonstrate how diabetes educators can help to transform those harmful beliefs, thereby promoting positive change and more effective diabetes self-management. So let's get started. When you think about your patients who are having a tough time managing their diabetes successfully, it's easy to assume that they're unmotivated. But let me ask you to consider that that may not be true. In fact, neither your patients, nor you, nor I are unmotivated to want to live a long and healthy life. The real issue is that day-to-day issues arise, obstacles begin to multiply, and these can overwhelm any perceived short-term or long-term benefit. And unfortunately, there are so many potential obstacles: emotional, interpersonal, environmental, and more. Of the many obstacles our patients can face, here are 4 common and critical ones, all of which can interfere with a patient's best intentions to manage their diabetes. Depression, which we know is present at elevated rates in diabetes, is important to address. And I encourage you to refer depressed patients back to their physicians or to a qualified mental health professional. Other obstacles include poor social support from family or friends. Environmental pressures such as poverty, stress, and competing demands. And harmful health beliefs, which will be our focus today. Although there are many harmful health beliefs, today we'll discuss just 4 of the most common. Diabetes is no big deal. Diabetes is a death sentence. Nothing ever seems to work. And do everything just right, or else. First is the issue of perceived invulnerability, or the no big deal issue. Unfortunately, a very common belief. Perhaps you've had a patient who has said something like, "Diabetes, it's not a big deal, especially if you feel fine, and you can always worry about it later if you start to feel bad." To see if your patient might be thinking this way, consider such conversation starters as, "What worries you about having diabetes?" Or, "How concerned are you about long-term complications?" This can be a powerful first step towards identifying the problem. Since diabetes is relatively symptom-free, especially early on, this can be a hard belief to argue. But consider the potential power of that individual's own metabolic data. Lastly, using the testing in pairs tool we discussed earlier may provide a source of encouragement to the patient by demonstrating that relatively small steps can have a real positive impact on their blood sugars. And so we've introduced 4 core beliefs that can be potentially harmful: invulnerability, inevitability, treatment skepticism, and unrealistic action plans. And we've touched on the means for identifying and addressing them. Overall, please remember the importance of acknowledging your patient's beliefs in a respectful fashion. They're not crazy. They have arrived at their beliefs, harmful though they may be, from their own life experiences. Consider the tools we've touched on: testing in pairs, the diabetes scorecard, and the 360 view tool as a means to challenge some of those beliefs. Encourage patients to stay informed, relying on trustworthy resources, of course, like the ADA, WebMD, and more. And finally, help patients to succeed by introducing a collaborative approach to realistic action planning. By collaborating with them and utilizing their expertise in regards to their own lives and their own problem-solving skills, you can aid them in taking that all-important first step. Now I'd like to introduce you to Amy Hess, who is a registered dietitian and a CDE, and Amy will be playing the role of the diabetes educator in our case studies. Let's take a look.
Hello, Mr. Martinez. My name is Amy. I'm one of the diabetes educators. How are you doing today?
Please, call me Jeff, Amy. Nice to meet you, too. I'm doing okay, I guess, but I'm really worried about my diabetes.
What worries you most about it?
Everything. I'm an accountant. I've done my homework and read about what diabetes can do. Heart problems, even blindness. What worries me, too, is that my mom lost a foot to diabetes. That'll probably happen to me because my toes tingle sometimes. And she died young. The way I see it, I'm 63, so I may as well skip the exercise, enjoy the time I have left, and eat what I want, because I probably won't make it to 70.
Thank you for telling me how you feel, Jeff. Let me ask you, what are you currently doing to manage your diabetes?
Not much. I mean, I take my diabetes medicine sometimes, but my blood pressure feels fine, so I don't take those pills. I felt better when I used to weigh a lot less, back when I walked the dog every night, but then I quit, and now the poor dog and I are both overweight.
And what has your healthcare provider suggested?
Why bother talking with my doctor? It's all bad news.
So, if I'm hearing you right, you don't feel good because you gained weight when you stopped walking the dog. Your toes are tingling, and you're concerned about losing a foot, but you choose not to take your diabetes meds regularly. And you said you know that diabetes can cause heart disease, but you've stopped taking your blood pressure pills. Do I have that right?
Yeah, but when you put it that way, it doesn't really sound very logical.
Great point, Jeff. And since you took the time to be here, would it be safe to assume you're open to hearing about how things have changed in diabetes management?
Sure, I consider myself an open-minded person.
Good. And you said you're an accountant, right?
Yeah, I've been one for many years.
And when did your mom have her foot amputated?
Oh, it was back in the 50s.
And back then, people did their accounting on paper, right?
Yeah, no one had computers back then.
Well, Jeff, just like we developed new and better ways to do our accounting, we've also made advances in managing diabetes, including ways to minimize the chances of going blind or losing a foot. If I told you some of the things we needed to focus on were walking regularly and taking your meds consistently, would you consider doing them?
Well, yeah, those things aren't hard. I just didn't think they would make a difference.
Jeff, you don't have to take my word for it. You can look at websites sponsored by the American Heart Association or the American Diabetes Association. And I'd also like to share this diabetes scorecard with you. It outlines 3 important health numbers: your A1C, blood pressure, and LDL cholesterol. I'd encourage you to meet with your doctor and talk about your numbers and your odds of having future problems. What do you think?
Yeah, I can do that. It's just 3 numbers, and my doctor's a pretty good guy.
What do you think about selecting 1 or 2 things that you can do to manage your diabetes?
Well, I could definitely go back to walking the dog. He'd probably like that too. And frankly, I didn't have a problem taking my pills. It's just that before I didn't see the point. But like you said, a lot has changed. And maybe if I take good care of myself, I can live a better life than my mom did.
That's great, Jeff.
Amy's done a nice job of not pushing Mr. Martinez too hard. Rather than talking about what exactly do you need to do, trying to scare him, she's really stepped back and addressed what needs to be addressed, which is how hopeless Mr. Martinez is, fearing that he's going to end up just like his mom. By focusing on that one particular belief, she's going to make more progress with Mr. Martinez than most people would. By letting him know, just like using that analogy from accounting, that in fact things have really changed. And wanting to emphasize something that we've mentioned before, that with good care, odds are good. You can live a long and healthy life with diabetes. And pulling out the diabetes scorecard, encouraging him to get his real numbers and having a conversation about that with his physician is also a good way for Mr. Martinez to hopefully learn that in fact his real risks of running into some of the problems he saw his mom go through are in fact much, much lower than he could ever possibly imagine.
Hi, Jeff. How are you today?
Hi, Amy. I'm doing pretty good. I brought in that diabetes scorecard to show you. My doctor filled it out, and we talked about what the numbers meant and what happened with my mom's diabetes.
Okay, well, let's take a look. So your A1C is 7.8, your blood pressure is 140/90, and your LDL cholesterol was 120. What did the doctor say about those numbers?
He said they needed some work, but with some small changes, we could get them in a safer place. He said nowadays we have new medicines and better tools to manage diabetes that they didn't have back when my mom had it. And just because she lost her foot and died young, it doesn't mean that's automatically going to happen to me.
That's good news, Jeff. So what have you been doing since our last visit?
I'm taking my diabetes and blood pressure pills every day now. And I walk the dog a couple times a week. The doctor also mentioned I should check my blood sugar at home and try to keep it in the target range he gave me. He said you could show me how to use a blood glucose meter.
It sounds like you're committed to managing your diabetes, Jeff, and you've already taken some great first steps. I'd be happy to help.
Hello?
Hello, Ms. Martino. I'm Amy, one of the diabetes educators. I had it on my calendar to call you today. Is this a good time to talk?
Sure, I was expecting your call. Please call me Kathy. I have to tell you, I'm still shocked about this diabetes thing. There's so many things I have to learn to do. I guess I can say goodbye to my spaghetti because I hear that since it's a carb, I can't eat it anymore. My nurse showed me how to use this Aviva meter. It's easy to use, but I'm not really sure what the numbers mean. You know, Amy, I'm not sure I can do all this stuff. With a busy job and taking care of my granddaughter, I just don't have time. But I read that if I don't do all this stuff right, I could go blind. I still can't believe this is happening to me.
Kathy, thank you for your honesty. It sounds like your diabetes diagnosis came as a shock to you, and you're feeling overwhelmed by all the things you think you need to do to manage it. Would it be helpful for us to talk more about that?
That would be great.
Let's step back for a moment. You mentioned your granddaughter. Tell me a little about her.
Her name is Sarah. She's 8, and she means the world to me. I take care of her after school.
Sounds like she's very important to you.
She sure is.
Let's think back to when Sarah was a toddler and started walking. Learning to manage your diabetes is a lot like that. First, Sarah crawled, and then she took a couple of steps. She fell down a few times, but she kept moving forward. And before you knew it, she was running.
Yeah, I can still see the determination in her little eyes.
She had a goal and she kept working at it. Diabetes management is similar to that. It's about taking one step at a time and making small changes that you can live with. It's about progress, not perfection. Our goal is to keep your diabetes in a safe place by keeping your blood sugar and blood pressure as close to normal as possible, to help reduce your chance of complications and continue enjoying your time with Sarah.
That's what I want.
So where would you like to go from here? Is there an area you'd like to focus on first?
Amy, I feel like I need to give up one of the best things in life, enjoying my homemade spaghetti with my friends.
Kathy, having diabetes doesn't mean that you have to give up certain foods.
Really?
Let's start with the spaghetti. You don't have to stop eating it. Maybe just try eating a smaller portion. What do you think?
I guess that sounds doable, but how much can I eat?
I'm glad you asked me that. We can schedule another time to talk about portion sizes, but if you have your Aviva meter box handy, can you pull out the blue CD packet?
Oh yeah, it's right here.
In the back pocket, there's a small purple colored tool that says Accu-Check Testing in Pairs on it. Can you open that up?
Got it.
Using this tool will help us see how what you're eating affects your blood sugar. So in addition to your morning testing, check your blood sugar before and 2 hours after you eat your spaghetti, and write the numbers down in the before and after columns. Also, jot down how much you ate. The next time, eat a little less, do the same thing, and then we can talk about it on our next call.
Well, that sounds easy enough.
What specifically do you want to focus on over the next 2 weeks?
I'll keep taking my medicine. My pharmacist said that was important. And I'll also try experimenting with my spaghetti portions and use this little tool.
It sounds like you have a plan. One small step at a time. Can we continue talking?
We've seen Amy meet Kathy on the phone. Kathy, who's just been diagnosed with diabetes and is feeling overwhelmed that she has to do everything perfectly and that she's going to have to give up her very favorite foods. This, as we know, is so common for people who've been diagnosed with type 2 diabetes. And we see how Amy has done a nice job of saying, no, this doesn't have to occur, that we can tackle each piece of this one at a time, and that there, in fact, is no need to be perfect, and there's no need to give up your favorite foods. To address this head-on, she introduces the Testing in Pairs tool for Kathy as a way to help Kathy see how simply adjusting how much she eats, for example, will affect her blood sugars in a positive manner. We have found that using the Testing in Pairs tool in this way can help Kathy get excited and engaged about being more interested in making her own changes in how she eats rather than just feeling like she has to deprive herself. This is a terrific start for Kathy, and I'm glad to see how Amy has approached this.
Hey Taylor, nice to see you again. How's it going?
Hey Amy, I'm doing okay, I guess, but this juggling my diabetes in college is tough. I just started my freshman year, and it's basically the first time I've ever been on my own. It's kind of hard. Between classes that start at 8 a.m. and cramming all night for exams, I'm crazy busy.
I remember those days.
Well, a lot of times when we study late, we order pizza. And between little to no sleep and the carbs, my numbers are all over the place. And as much as I try to eat healthy, you know, college food, I've put on like 10 pounds. My parents are really cool, but I don't really want to tell them all this and have them wig out. I feel like I've got to get 100% on my diabetes test every day and try to figure out what's going on with my numbers and how much insulin I need. I just don't know if I can keep up with it all. It's not like I want to drop out of school because of it, but I don't know.
Taylor, I really appreciate you being so open about this. I know sometimes it's tough to talk about. Sounds like you're putting a lot of pressure on yourself. Like you feel like you have to do everything perfectly. And if you don't, then you'll have to drop out of school. Am I hearing you right?
Yeah, that's basically it. But I mean, what am I going to do?
Well, how about starting off by talking about when your numbers are in range?
As much as I hate to admit it, when I go home on weekends, my insulin and blood sugar numbers are close to perfect because I'm used to what Mom cooks, I know how much of it I can eat, and how much insulin I need to cover it.
Well, that's a good first step. What do you think of building on that and applying it to those late night study and pizza sessions?
I guess I could try it.
Now, of course, I have to suggest, from experience, you know, that we limit those all-nighters. But since we know they're going to happen, we can try to plan for that and figure out how much insulin you need to cover the pizza.
Now, that would be a big relief.
So let's take this one step at a time. Let me show you a cool little tool that we can use to figure out what's happening with your blood sugar levels. It's called the Accucheck Testing in Pairs tool.
How does it work?
It's easy. Check your blood sugar before and after you eat late night pizza. Jot down how much you ate along with your insulin. Try that for about a week until you get in your target range consistently. What do you think?
That looks easy, and a few more checks on those days are no big deal.
Great. Sometimes, Taylor, you might go a little high, and we'll work together to address that. College can be stressful, but don't feel like you have to drop out of school because your numbers aren't in range 100% of the time.
I know, nobody's perfect. Whoa, that sounded just like my mom.
Speaking of your mom, you mentioned how supportive your parents are. They might be a good resource for you.
My mom has always been a big help, but I feel like I want to try to tackle this myself first.
That's cool too, but if you ever need an ear, I'm here for you. Is there anything else you'd like to talk about?
Well, maybe we could spend a few minutes talking about exercise.
You've seen Amy do a nice job of addressing Taylor's concern that she has to do everything perfectly. And as we know, if you feel like there's only two ways of dealing with diabetes, you're either perfect or bad, it really sets you up for being discouraged, as we see what happened to Taylor. Amy's done a nice job of meeting Taylor halfway. Of course, Taylor needs to continue to engage in the crazy behaviors college students do. And Amy's supporting her by saying, let's not talk to you about stopping that, but let's find a way for diabetes care to fit in. And she also introduced the Testing in Pairs tool as a way of saying, you don't have to change everything at once. Let's focus on one difficult task and see if we can address things one point at a time.
Hi, Taylor. How's it going?
Hi, Amy. I'm doing better. I'm starting to get the hang of college, and I use this testing in pairs tool to help me with my late night pizza.
That's great, Taylor. What did you find out?
Well, as long as I eat the same amount of pizza when we cram at night, I figured out how many units of insulin I need to cover it and stay in my target range. But it's more than that. It's almost like using the tool to help me figure out that problem gave me the confidence to tackle other things.
Like what else?
Remember when I told you I put on 10 pounds? Well, I'm trying to lose it, so I started swimming. And I used the testing in pairs tool to figure out what I need to do to keep from going low. It made me feel like I could get a handle on juggling my diabetes in college life. Do you know what I mean?
Yeah, I do. It sounds like it gives you a feeling that you're more in control. Is that about it?
Exactly. I feel like I'm managing my diabetes, not the other way around. And I'm not going to think about dropping out of college just because I'm not in range 100% of the time.
That's great, Taylor. You're right. You don't have to do everything perfect to have well-managed diabetes. We also want you to have a life and enjoy college.